Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Logan Ledet, an infectious diseases specialist at Terrebonne General Health System. We will learn a little bit more about her role in infectious diseases and the vital service that she brings to our community. Welcome to the show, Dr. Ledet.
Thank you so much.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
So I grew up in Houma. I did a lot of my medical training in New Orleans, and I was excited to come back to Terrebonne to practice as an infectious diseases physician. So I work with primary care doctors in the clinic and then hospital doctors and surgeons in the hospital to either treat complicated infections or figure out if an infection is going on and contributing to what's making you sick.
Okay. When did you first decide you wanted to be in the infectious disease medical field?
I knew I wanted to be a doctor since I was a little kid. Honestly, I always liked science, and I wanted a job where I can feel like I'm helping people. Hopefully I do. And then I realized I wanted to do infectious diseases during residency. You first train in internal medicine, general medicine. You rotate through most specialties, and infectious diseases was what I found most interesting.
What interested you most about it?
I really like the people that I worked with, and honestly, we get consulted on the most interesting patients in the hospital. The complicated things that kind of make you scratch your head and go, I wonder what's going on there. We help figure it out, and I find it really rewarding.
All right, and what types of diseases do you treat?
So infectious diseases are diseases caused by microorganisms, so we mean things like bacteria. So people know staph infections. Viruses, everything from obviously COVID to things like HIV, and then rare infections like fungi, parasites, those types of things.
As an infectious disease specialist, how are you going to help patients in the hospital?
So in the hospital, I usually see a patient because the main doctor taking care of them, whether a hospitalist, an internal medicine doctor, or a surgeon, either they know there's an infection going on that's going to be complicated to treat, or they're concerned there might be an infection contributing. So I either figure out the best antibiotics or medicines to treat that infection, or the best path to take to figure out if an infection is going on.
Okay, and I'm sure you collaborate with other physicians. How do you collaborate with the primary care physicians?
So that starts with a referral. It's a similar process where your primary care doctor is concerned that you either have a complicated infection or you're sick from an infection. They can't quite figure out what it is. So they send over a referral asking a specific question. And they send over the workup that you've had thus far. So that way it gives me a chance to review it and familiarize myself with you and your case if you're my patient. And then come up with a good plan for when I see you in clinic to figure out what to do next.
So you see patients both in the hospital and at a clinic?
I sure do.
All right, and why is this specialty so beneficial to our community?
So infectious diseases doctors, we not only help treat and figure out infections going on, we help prevent infections as well. So I work with our wonderful infection control nurses to help prevent people from acquiring new infections in the hospital. I also work on vaccine initiatives and making sure that they're available to our patients. And then also our pharmacists, we have fantastic pharmacists, things like antimicrobial stewardship or antibiotic stewardship, where we try and make sure that you're getting just the antibiotic you need for just as long as you need it, and preventing the emergence of drug-resistant infections that are more difficult to treat and can make patients more sick.
Right, that's a very big initiative these days.
It is.
So as you said, you do see patients in your office. Can you elaborate a little bit more on how that happens?
So like I said, it usually starts with a referral. Right now my clinic is a little bit small, but we're growing and there's been a lot of interest in patients coming see me. So I usually ask, patients have asked me, how do they see me as their doctor? Like I said, usually I ask that you see your primary care doctor and they send over a referral and they can kind of send me the information that I need to be able to help you.
Okay. And what are the three most important things you want people to know about infectious diseases?
That I see patients in the hospital and the clinic. If I see you in the hospital, I'm aware of your case the whole time that you're there and keeping an eye on things. And if things are complicated, I will always see you in my clinic. I'm happy to see any patient that is concerned about an infection or a wound, or just has more questions about the antibiotics that they've been given. And that I'm really happy to be at Terrebonne General, and I really hope that I can contribute to both patient care and safety in the hospital.
Okay, well, we're so glad to have you back in your community where you grew up. Any final words about being back here?
It's been a really wonderful experience thus far. Everyone has been incredibly welcoming and helpful as I try and navigate starting a practice. So I'm very, very appreciative of everyone that I've worked with at Terrebonne.
All right, well, thank you so much for being here today, and we look forward to working with you in the future.
Thank you.
For more information on Dr. Logan Ledet or infectious diseases at Terrebonne General Health System, please visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alford, and we'll see you right back here next week.